So we're going to show you how to care for your pet's O-tube. So twice a day you need to be changing the dressings that are around your O-tube. So you're going to start by just taking everything off. There should be 3 layers, including a non-absorbent dressing, as you can see here, that just sits over the tube. Now you want to observe the pad, make sure that there isn't any discharge on there. Have a look at the site and make sure that there isn't any excessive swelling, any pus, any changes there. Now there usually is a degree of redness, so as you can see here, it's a little bit red around the insertion site, but generally speaking, I'm happy with that. Now, in the event that you have any concerns about what your stoma site looks like, it's always advisable that you contact your veterinary surgeon just to discuss. It might be that they ask you to send a photo over so that they can have a look. But yeah, any concerns, just let somebody know. Now, it's quite important to note that when you handle these tubes, you should be wearing gloves. These will have been supplied to you. Now, with the bandaging, you have a soft layer, which, as you can see, you just want to wrap that around the neck. This bandage can be applied quite firmly. It's quite a soft dressing, but just make sure that you can get 2 fingers down either side, that it's not too tight or uncomfortable for your pet. The last layer, as you can see, this white sort of self-adhesive bandage. Now you do have to be quite careful with this one because it does get tighter as you go around. So make sure that you pull it out nicely before you start to advance it around the neck. And just make sure, again, that you can get 2 fingers down the side of the bandage. Now, usually these tubes are quite long, so you might want to just tuck the end of it under the bandage just to stop it from flapping around and being a nuisance to your pet. That concludes your bandaging. As I say, you only need to perform that twice a day. And we'll move on to feeding and using the tube. Now, if you have medications for your pet, there may be some liquid medications, there may be some tablets that you're able to crush and sort of dissolve in water, which means that you would be able to utilise this tube for medication administration. Now, usually we would advise that you give medications before feeding because the food will help to flush the medication through the tube. Now, before you put anything down your tube, you want to make sure that you've flushed it to check patency, but also to ensure that it's in the correct position. So you want to be observing your pet for any signs of discomfort, any coughing. If you notice any of those signs, then it's important that you stop what you're doing and contact your veterinary surgeon. Moving on to feeding, once you're happy that the tube is patent, it's not obstructed, then you can go on to giving your food. Now, there are a variety of different foods that are available. As you can see, this is a liquid Royal Canin that comes in a bottle. These need to be kept in the fridge, and it's important that the liquid is warmed to room temperature before feeding. Other foods available include convalescents, which is a powder which will be sort of constituted according to the instructions on the packet. Again, needs to be kept in the fridge and should be warmed to room temperature before feeding. When giving food, it's important that you do it over 10 to 15 minutes, just at a nice slow pace, constantly observing your pet to make sure that they're happy and comfortable throughout the process. Again, if you notice any signs that they either look uncomfortable, any lip smacking, any regurg, then I would advise that you stop feeding for the time being and perhaps try again a little bit later. If you continue to see those signs each time you attempt to feed, again, just contact your veterinary surgeon and we can advise further. Each patient will be given their own tailored feeding chart, which will detail the amount of food that you need to administer per feed. Now, depending on how long your pet has been not eating for, will determine over what days we give their total requirements of feeding. So it might be that when you first take your pet home, he's only on a third of the nutritional requirement that he needs, just because we're easing him back into eating and taking food, and we will slowly increase the volume of food that we're giving over a 3 to 5 day period. Of course, this will be unique for your individual animal, and that will be explained to you on the day, and as I say, you should have a food chart there. So as you can see, this little guy is quite happy with his food. He's nice and relaxed. He's taking it really well. We've got no signs of discomfort, no signs of nausea. So generally this is a successful tube feed.